Now, the old rules apply except for the following amendments. Airlines who board passengers without PCR results or who transport or disembark passengers with positive PCR test results into Accra will be fined $3,500 per passenger. Ghanaian residents who depart Ghana and return within 1 week will no longer be required to present a COVID-19 result from the country of departure. They will, however, undergo mandatory COVID-19 testing upon arrival in Ghana. Passengers will be subjected to the mandatory COVID-19 test at the airport terminal at a cost to be borne by the passengers as indicated as following. Ghanaian and ECOWAS citizens now, effective, I think, 8th of February, 6 p.m. UTC, pay $50. All other passengers will continue to pay the $150, and this must be paid before embarkation. And if that doesn't take place, the airline will be sanctioned for it. Non-Ghanaian passengers may be refused entry and return to the point of embarkation at a cost to the airline if there's no proof that they have complied with these guidance notes. Ghanaian passengers will have their passports seized, the passenger handed over to the state security agencies and taken into a 14-day mandatory quarantine at the designated location at the passenger's cost. That is for those who, for some strange reason, it is found that they have not complied. The airline will be surcharged and the individual will also face the measures that I have just mentioned. All arriving passengers who test positive for COVID-19 will undergo mandatory isolation and treatment at a designated health facility or isolation center at a cost to the passengers except Ghanaian citizens. I want to take that again. All arriving passengers who test positive for COVID-19 will undergo mandatory isolation and treatment at a designated health facility or isolation center at a cost to the passengers except Ghanaian citizens. At first, the state was bearing the entire cost. This is an amendment of the guidance note, so please do take note and let the world know. Now, for passengers who are transiting and transferring through Accra, they will not be required to take the COVID-19 test in Accra. Transit passengers will be required to adhere to COVID-19 testing requirements for the destination countries. Some category of persons are exempted from this. Airline crew, as has been advertised already, are exempted from the pre-departure and arrival COVID-19 testing and should follow the airline policy for testing. There's a separate policy for them. They'll have to follow that one. Children under 5 years of age will not be required to undergo testing on arrival at the Kotoka International Airport. Passengers who arrive under emergency circumstances, such as diverted flights, will not be required to undergo testing if they do not leave the airport or remain in isolation in their hotel. Children between the ages of 5 and 12 years will be required to pay for testing at the new rates. That is the new rates that I've just outlined. And then very finally, for passengers who are departing the Ghanaian jurisdiction, passengers will be required to adhere to the COVID-19 testing requirements for their destination countries. Departing passengers will undergo temperature screening at the entrance of Terminal 3, and passengers are advised to arrive at the airport at least about 4 hours before scheduled departure time to enable all of these COVID protocols to be adhered to. So that's a quick amendment to our air travel guidance notes that I would like to share with you this morning. I want to invite Dr. Patrick Kuma Abuaje to give us a quick update on where we are on COVID, whether the situation is getting better or is getting worse, and then some of the surveys they've been conducting, and also share with us the outcome of those surveys. Doc, good morning and welcome.
Good morning. Good morning. Thank you, Honorable Minister. Today we're going to give you a regular update. We'll cover the epidemiological situation, the distribution of cases and recoveries, case on admission, the response to Aden Kotoka International Airport, and finally we've done a couple of surveys on the adherence to the protocol including some churches that we visited. We'll share the findings and then provide necessary guidance. Averagely, we are reporting about 600 to 700 cases in Greater Accra, and Greater Accra still remains the one with the highest coverage. Usually about 60% of all the cases are in Accra. And they are mainly located, as always, remained the Accra metropolis and the adjoining districts. We still have an increasing number of workplace outbreaks now, because now it's moved from the family outbreaks into the workplace outbreak, and so we need to look at that. There's also recorded some decline in international travel. For example, yesterday, we tested 953 passengers with 2 positive, so that's quite an impressive reduction so far. The correct use of face masks in Greater Accra has significantly improved, and we can do more. So as of the 6th of February, we have recorded about 73,003 cases. We've conducted 814,000 plus tests, leading to about 26,114 per million tests for population, with a cumulative positivity of 9. You can see that the cumulative positivity is gone up from about 8.2 to 8.4 now to 9%. We had about 89% of this number discharged. We have recorded 424 deaths, and with active cases of about 5,515. Majority of the active cases are in Greater Accra, as I mentioned, 17% in Ashanti and Western. Currently, all 16 regions have active cases, and 243 districts, which means that we have about 17 districts that has not reported any case yet. For this current reporting period, about 8 regions did not report any case at all. We have done a lot of contact tracing. They listed about 12,000 since January, and we have followed about 11,926, and 576 of this number have tested positive, bringing the positivity among contacts to about 4.8%. As you are aware, we are talking about the new variant, and the current statistics, as based on the analysis that was done both from passengers and population, we have, I'm going to take you through what it is. The analysis, as at November, there was no new variant in Ghana, but about 90 viral sequences was done. In December, we discovered the presence of the UK variants in patients were detected. In January, when we did a mandatory quarantine at the KIA, we found about 45% of those quarantined had the UK variant. 15% had the South African variant. This is a percentage, but in actual fact, it comes about 1. In the travelers, in January 2021, the UK variant was found in patients in Greater Accra, about 88%, 90% in Takoradi, and 25% in Tamale. So far, no South African strain have been detected in the local patients in Ghana. So that is what you have shown there in the chart. If you look at the next slide, which shows that the epidemiological curve, you can see that this current wave is going up. It's remained stable up there. We are hoping that with improvement in our protocols and adherence to hand washing, social distancing, and mask wearing, and of course with the implementation of the new restrictions, we should expect that if we all follow, it should come down. And the same shows that the moving average of the cases, that is now doing about 600, has remained around 600 for a while now, in the last few days. Let's hope that it stays down and starts coming down. But that will depend on what we do, and that's quite important that we do that. The next slide shows the active cases against the total number of cases ever reported. You can see that Greater Accra Ashanti, Eastern, Central, and Western still remains the dominant area where we reported so many cases. You can look at the monthly distribution of cases. You can see that still Greater Accra accounts for a significant number of the cases at all times. And the active cases, as you can see, has reached a level that we've never reached before. You can see that it's really gone quite high. And so we need to really make sure that the numbers start coming down so that the number of active cases will also come down. Equally, the number of tests continues to rise in response to the number of positives that we are getting as we do additional contact tracing in response to the high numbers of positive cases. And we peaked almost about 4,500. We're doing about 3,750 currently a day. Now, the age distribution of the cases, these are in percentages. If you look at 0 to 5, it's about 1.3% of all the positives are, as for this year, are in the children age 0 to 11. But if you compare with the incidence in 2020, you can see that's only a marginal increase. If you look at the 5 to 14, there's a slight increase in 2020, of course, looking to about 3.9% compared to 3.1%. 15 to 24, you've seen a reduction, a slight reduction from 17% in 2020 to about 13% of the proportion of those who are positive now belonging to that class. In the area of 25 to 44, which is the most active group with the number of cases, the percentage has remained the same, no much change. But if you go to 45 to 60, that's when you see that we have more people, aged people in 2020 who are positive, and those above 60 who are positive compared to what we had in 2020. This could also explain why we also, in addition to the new variant, we have more people falling sick because of the age changes in the number presenting. So for today, we have recorded 675 cases. Probably the first below 700 in the last almost 8 to 10 days. They came from 44 districts and 8 regions and the airport. Greater Accra recorded the highest number of 84.8% of all of them came from Accra. In 13 districts and a metro, Greater Accra recording the highest amount. Ashanti recorded 99 new cases from 9 districts, with Oforikrom recording the highest number of cases. And must say that Oforikrom and Ayawaso West, it is because of the location of the labs and the way it is reported. It doesn't mean that Ayawaso West is and Oforikrom is the dawn of COVID, but it's the reporting practice because of the labs. Eastern region had 52 cases, mainly from Upper Menyakrobo, then Chembo, Jabin, South, and Ebuakwa. Western region had 35 new cases from Takwa, Mpoho, Ahanta West, Wassa East, Jomoro, Nzema, and Wassa Amenfi. Volta region reported 50 new cases. Ho had 5, Hohoi 29, North Dai 15, Southon 1. Central region reported 10 new cases. In Upper Denchira, East and Western, 8 new cases. From Bia, Torebo, D1, and Sefiyo, also class Western of 4. In Bono, we have 13 new cases. 13 new cases in Sunyani, Doma Central, and Brekum West with 2. Doma Central had 5 cases. At the Kotoka International Airport, on the 5th and 6th, we reported 5 new cases. And as I said earlier, Bono Ahafo, Bono East, Northeast, Northern, OT, Savannah, and Upper East and Upper West did not report any case on these dates. Our total number of cases on admission across the country is 267 for COVID. We have 29 of them being critical, and severe cases about 111, and the 127 of them are mild to moderate cases who are currently on admission. Let's go to the KIA Kotoko International Airport. Yeah. We have so far reported positives of about 1,158 so far, with a predominantly male 61% and 39% being female. And of course, a significant number are non-Ghanaians, 60% against 40% Ghanaians. And so far, we've tested about 157,000 cases with a cumulative positivity rate of 0.73%. So you can see that even the positivity rate is still lower than the general population in Ghana. As we said, we peaked somehow then we had a lot of large cases in December and January. But since February, we received some reduction as it shows on the daily positives that are recorded. And in the next slide, show you that in January, we have 430, as against 46 in September when we reported. So far, at the end of the first week of February, we have recorded 27 positive cases. We are hoping that if the trend continues, we'll record much lower figure than January and December. Update from the schools. I believe that there's been a lot of talk about this. We've had upper senior secondary school outbreaks in Upper West, Western, Greater Accra, and Eastern region. 23 schools in Greater Accra have so far reported 56 cases and no fatality. And I must show that parents have duly been informed. So if I come to that, we can look at the spread of the schools that are, then we have averagely 23 cases and total recovery 0 among others. But you can see that we also have some suspected cases of about 166 that we are still following up to see. And we have some staff also affected in the schools. Central region has also reported, okay, let me talk first about the Akosombo one. As of 28th of January, a total of 500 in the Akosombo International one that has always been in the media. As at we had done a total of 553 samples have been tested, with 82 of them being positive. Students were 73 and 9 staff were positive. A total of samples have also been collected and tested, with 13 confirmed positive. That's after the 31st. And so that brings the total number tested to about 600. That's almost the entire school has been tested. This was a result of a positive case at home that they decided to do a test. The Greater Accra, the national and the regional team has visited the school, done our assessment, given our recommendations on how to improve the social distancing among others protocol to cut down spreads. And so all of them are well and isolated, and those who are close contacts are still being observed so that we can contain the spread. Central region and the whole region has reported 8 cases from about 7 or so schools. 2 of them have already recovered, so they have 6 active cases among the schools in Central region. So that's it for the schools. When it comes to the first mark survey, we have, I said, the adherent protocol on face masks in Greater Accra region. We have 6 target districts, which are the current hotspots. We also visited 43 communities, including lorry parks, bus stops, busy streets, street intersections, overhead, under traffic lights, crossings, markets, and commercial centers, etc. The data was collected on 29 January, and then subsequent one has already been done. So, unlike the previous one where we had about 42, the number of people mask appropriately has improved, moved from the 42% to 47%. Those not wearing mask at all is 29%, and those not wearing correctly is 24%. So that's still quite a marginal improvement. We expect it to get a bit more. So we look at the morning and then afternoon. You can see that the morning is better. In the morning, we had about 52% wearing masks, as against 41% in the afternoon. I don't know whether it was the heat or whatever, but the number declined at that level, but the rest remained the same. So that's when you do a comparison in the morning. The next slide shows you the current trends in terms of wearing masks, that since the 7th survey, we have seen move to 42% and now to 47%. We hope that the trend will continue going up, and while those who are not wearing masks at all will also continue coming down, having dropped from 36% to 29%. Those who are wearing masks, who are not wearing masks correctly, are to move from 22 to 24%. So we are hoping that all of them will start coming down, whilst the green one starts surging. So in conclusion, the wearing of masks correctly has increased from 42 to 47. Those not wearing masks at all decreased from 26 to 29. Base mask wearing is generally better in the morning than in the afternoon. And this applies to both adults and children. 55% of children wore masks correctly in the morning, and it dropped to 29.5% during the late afternoon. 51% of adults who wore masks correctly in the morning dropped to 43% late in the afternoon. So it looks like the afternoon is something we need to really make an effort to ensure that people keep their mask on in the afternoon. And also increase generally, even the morning one. Generally, correct wearing of the mask has seen an improvement in some communities that we visited. For example, in the previous survey, University of Ghana main entrance, we had 78% of the people who observed found to be wearing their face mask correctly, compared to 84% in the latest survey. Another example is the Nima, where nearly 70% of people were not observed wearing the face mask at all. In the previous survey, declined to 67%, and so there's an appreciable increase in the adherence to the protocols. The proportion of people who were wearing masks correctly in the face mask slightly higher among adults than for the children. The proportion who were not wearing the face mask at all were also slightly higher among males than the females. And Ayawaso West District registered the highest proportion of people who were wearing the face mask correctly, 60.3%. And Ablekuma Central registered the lowest proportion not wearing masks correctly at almost 37%, 36.9%. The top 3 communities located location that had the highest proportion of people wearing the mask correctly were University of Ghana, Legon main entrance, and then the 37 military hospital bus station. The top 3 communities where they have the highest proportion of people not wearing masks are the Nima Market, Glife Lorry Park, and Asofan Last Stop bus stop, which is about 62% of them were not wearing masks at all. So let's take note, and I hope they also get the message. So in conclusion, compared to the last survey, the number of people wearing the face mask correctly increased from 42% to 47%. I think this is just a rehash of what we've done. We subsequently went on to do the protocol in some selected churches in Greater Accra. And these are some of the findings. The number of churches visited were about 38 in 14 districts. We also had churches, 43 of the COVID safety protocol adherents, where the denomination were charismatic, Orthodox, Pentecostal, Evangelical, Adventist, and spiritual churches we all attended. The sizes of the churches, we have very large churches. That's those, we are classified as those very large churches with over 1,000 membership, between 500 and 999, the large, medium of 100 to 500, and the small, that is those under 100. The period of visit assessment was on Saturday and Sunday during the entire church service. The observation and count of church members of how they wore the face mask was done. And we also look at checklists on adherence to COVID protocol was done. So what were the findings? We realized that about 90% of membership in those churches wore the mask correctly. 6% not correctly. And then about 3 or so, 4% were not wearing the mask at all in church. Comparing the proportion of whites and the general population, you can see that in the church it's 90% compared to 47% in the general population. So the churches are doing much, much, much better. We had more females that were visited. I mean, the population, about 62% were females against 38% male. So you can see that we had for not wearing comparative, it's about the same between male and female. So there's not wearing mask at all. It's about the same, 4.3 to 4.1% between male and female. Not wearing correctly, it's about 5.6 against 5.8. So that we didn't see significant changes between males and females, whether they wear them well or they wore at all. So if you look at the members, you can see for the church members, about 91.7% were wearing masks properly. When it came to the ushers, protocols and security, it dropped to 85.9% wearing masks. When it came to the pastors, priests, and elders, it dropped to 82% wearing masks properly. And then the choristers was the lowest, 62.6% wearing masks. If you look at also in terms of the classification of the churches, the larger churches were doing better in terms of wearing the mask. About 98.6% of the large churches wore their mask religiously. And then it drops to 73% for the small churches. So when it comes to the protocols, we looked at availability of one location at the church, that is when it comes to temperature screening. We had 25% when having the temperature. 13 had some means of taking temperature. About 5 of them had no method of checking temperature at all. So that is in breach of the protocol that we disagree with them. Hand hygiene, we had about 7% available. Of the 43 churches we visited, 7% had none at all. They had it available. Utilization also dropped to about 88%. So having is one, using is another. So there's a slight drop in the number of people who actually use the availability of hand hygiene protocols. Alcohol rub, only 81% had alcohol rub to spray in their hands to clean, and about 19% of these 43 churches did not have. For social distancing, we looked at adequate space arrangement of church pews and to ensure social distance in church. About 88% had. We had also church, whether they maintained distance during sitting at the service. We had about 79.1%. Choristers and singers maintained social distancing. It dropped to 74.4%. Church maintained social distancing during interacting during each other during the church service. Dropped to about 41.9%. And 9.3%, that's 4 churches, allowed handshaking in church. When it comes to the use of the microphone, the choir members and their singers who are exchanging microphones during the singing was about 48%. They were exchanging microphone. Only 41% actually frequently sanitized the microphones that they were exchanging among themselves. So that's a major challenge that has to be addressed. Risk communication. Posters, do they have posted information about the face mask use? Yes, about 81% had the information on posters. Were they making audio announcements in the risk communication? Yes, that's also, that number dropped about the use of hand hygiene and, well, as much. The duration of church service. 47% actually went beyond the acceptable duration, against 53%. So in summary, 90% of all members of the church, that's 38 churches, visited wore their mask correctly. 6% were not. There was no difference between the proportion of face mask wearing between males and females, and the proportion of face mask wearing was the highest among the church members compared to the ushers, as I mentioned, the protocol and security, to 80%. And pastors also, the use of masks had dropped to about 83%. Choristers and singers dropped significantly to 63%, especially when you know that during singing is when you can actually share the highest number of viruses. That is something that's worrying. Proportion of correct wearing of masks was highest in the large churches, 99%, compared to 88% among the smaller churches. We found that one church in Wejabawe had the highest proportion of members wearing the face mask correctly, 98.6%, compared to a church in Okaiki North that had 80% wearing masks only. So that's 2 churches had all members wearing masks, and we'll send them a note of appreciation. We can't mention their name here. So, some of the recommendation is that in the church, everybody must wear a mask. If you feel that you can't wear a mask during singing, they don't sing, because that's when you really shed most of the virus. All ushers, security members should wear masks at all times. So they are the ones who come in contact with nearly everybody. So that if they are not wearing masks, it creates more danger to the population, people who are protecting themselves. The no mask, no entry, and the maintenance of wearing a mask during should be enforced in all churches. We're also encouraging churches to keep record of people who attend churches, so that in the event of an outbreak, we're able to do contact tracing. We should ensure that the hand hygiene facilities are provided and utilized. Alcohol wraps should be encouraged in church. The leadership to ensure that members do not shake hands in church. Very, very important. Regular announcement of the safety protocols should be encouraged to be done more frequently, and the church should ensure that the duration of stays within the 2 hours that has been recommended as part of the restriction and the recommendations made. So in conclusion, broadly, the daily case incidence has been rising from the end of December. It has, however, remained high. But the number has remained stable in the last almost a week or so, and we are hoping that the number will start coming down. But of course, that depends on what we do. There's been a significant decline in the cases at Kotoka International Airport. There's been an observed improvement in the face mask use and adherence to the protocol generally.